Do you get genetic counseling, and what does that mean, and what does that help you where we are right now?
Well, in my career of 18 years, we didn't have gene, we just kind of heard about it. It was just coming out, and now we've got so much more that we know. We know that there are actually lots of genes that can increase the risk that a woman develops breast cancer. But from that also, we know that there are two genes that are most likely or are most prevalent at increasing a woman's risk. Fortunately, they're relatively rare. There aren't a lot of women in the population that actually have this gene, but it's very, very important to ask a woman about her medical history and her family history, because women that have close family members that are diagnosed with cancers when they're young are at higher risk for having one of these gene abnormalities, and those women need to be counseled appropriately about the pros and cons of undergoing gene testing.
So that's, if I remember correctly, that's BRCA1, which is breast cancer A1 and A2. If those are positive, you think about what in surgery, and what do you think about the ovaries, and what do you think about other family members?
Well, so we know that women who have breast cancer gene positivity have an increased risk. Some will say 50, some say 60, some say up to 70% chance they could develop breast cancer. But they also have an increased risk of endometrial cancer, ovarian cancer, and colon cancer. So individuals who are positive for a genetic abnormality that increases their risk from cancer will also need to know that whereas we need to address the fact that they're at increased risk for breast cancer, what about their ovaries? How do we screen for that? And colon cancer screening, very, very important. They're at higher risk for developing colon cancer, and at younger ages, we'd recommend screening colonoscopies.
Ovarian cancer?
Ovarian cancer, I mean, we really feel as though today in the world that ovarian cancer has a much higher genetic or predisposition component than we originally thought.
So before we run out of town, if somebody has an abnormal genetic counseling, an aggressive tumor, how do they decide unilaterally take out the whole breast, or whether they should take out both breasts? Or what are the chances, if you got it on one side, that you're later on going to get it in the other side?
And that's why the surgeon is very important for a patient to feel comfortable consulting with their surgeon, because that's something that is really important for them to ask. What do I do? Should I take both breasts at one time? If I do that, what options do I have? And today plastic surgery's come such a long way, but there definitely are some pros and cons to that. Very thin women without a lot of fat tissue are going to have a little bit harder time with a reconstruction, may require expanders, may not be able to have their reconstructive surgery done all at the same time, and might have to have surgeries done in stages because of that.
Who gives that counseling?
The surgeon and the plastic surgeon.
And the plastic surgeon. So there's a team.
There is a team.
OB/GYN, surgeons, plastic surgeons, genetic counseling, oncologists, pathologists. Back in the old days, it wasn't that way, was it?
No, it wasn't.